What is your anti-aging program?
I exercise 3 or 4 times a week. I have an excellent nutrition. I try to sleep 7 or 8 hours every day. I have a lot of friends. I like very much my job and I love my life.
What is your nutrition?
I think I have an excellent nutrition. I eat a lot of natural organic elements and don't eat processed sugar, just little alcohol, just little coffee. But the base of my nutrition are natural foods like green vegetables, a lot of fruits, a lot of nuts, a lot of fiber, and a lot of water.
Are you using skin products?
Yes, I use skin products every day, especially the oldest one. I like very much use vitamin A derivatives and vitamin C serums.
What about your stress? Are you doing anything about it?
Yes, I think that's the most important things that keep my brain in balance and relaxed. I have a very, very excited day is when I'm studying, when I'm practicing exercise, when I'm sleeping, because sleep is very important for the balance of our brain. When I am with my friends, and in the weekends, because I never work in the weekends, I try to do things that I like. I try to go to the beach to take a little exposure to sun and to do more exercise in the beach. And I think that is it, and to have a lot of love in our heart.
So, exercise, good skin products, sleep, a good psychology, and good nutrition can keep us young.
Yes, yes. This is very important to keep control of our aging process. But in sometimes we need other things.
Let's see which they are. Dr. Ayoub, what are the most effective anti-aging treatments reversing the signs of aging?
Yes, we have nowadays a lot of new devices, a lot of new treatments. We have the surgical procedures like a facelifting. But in my experience and what I saw in all my career in the aesthetic medicine, I have no doubt that the phenol peel, with the characteristics of remodelation of the face and with the capacity to do a tightening effect, do a regeneration of in all the layers of the skin, the phenol peel for me is the most impressive treatment to regenerate a skin, a face, and a treatment that we can consider an anti-aging treatment. We can reverse the signs of aging until 20 years with a good phenol peel procedure. It's very important to know the protocol of application of the peel, and you use a good product. And nowadays we have another types of phenol, like the oil phenols, that has much less complications and much more good results.
What are the results compared to those offered by a facelift?
Yes, the facelift has very good indications to improve the sagging skin, but not improve the photodamaged skin, the texture of the skin. And we have pigmentations changes in the aging process. When you do a surgical procedure just to get better the sagging of the skin, you can change all the signs of aging.
According to scientific studies, the phenol peel to which you are referring can cause cardiac arrhythmias and should be performed by experienced doctors. Has anything changed with this new phenol peel?
Yes, very much. The phenol has a lot of cardiac toxicity, and the heart is the most important organ we have to take care because of the effects of phenol. But we have new types of phenol that has very much less systemic toxicity because of the components that are mixed with the phenol. So we have a much more strong reaction with much less concentrated phenol, like the Baker Gordon phenol with more than 80% concentration. Now we have pills with 60%, and besides that, this new kind of phenol has slow absorption rates of penetration in the skin, so we have more time to detoxicate these chemical products. But it's very important that you know how to applicate this pill. You have to know about the protocol and what product you are using.
Why should someone choose such an invasive deep peel and stay at home 1 week instead of doing a laser or another less invasive treatment?
I think that the patient don't have to choose a treatment, because the most important is what is the procedure indicated for these patients. If the patient has a fracture, deep fracture in the skin, or a lot of photodamaged skin, I have lasers in my office, and I know by my experience and the experience of a lot of dermatologists and plastic surgeons, friends of mine, that there is no results or very bad results if you try to do a very deep procedure with one device like a fractional laser or another treatments or a TCA pill. It's very wrong to try to do a procedure that is not indicated for that kind of problem. So in this case, you said, the patient have to stay 1 week in your home. Yes, if she has or he has a very deep problem, and we have to go deep in a treatment, they have to stay in home for the regeneration phase of the treatment. This is very important. If the patients don't agree with these recommendations, it's better not to do a patient with this low compliance of the treatment. Okay?
Thank you very much.
Thank you.